Okay, I'm gonna give just a minute more here, and then we'll go ahead and get started. I think the only person we may be missing is Aaron, and I'm sure he will join here momentarily. Okay, so I have 1 o'clock. We'll go ahead and get going and welcome everybody to our, again, update for the COVID-19 pandemic with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will begin our news conference today with opening remarks from our guests, and then we'll go to your questions. And a reminder, we haven't done this in a while. If you have questions in the media, please put those in the chat. I'll relay those to the panelists and get those answered for you. So to begin with some short opening remarks, we'll first go to IU Health South Central Region President Brian Shockney.
Thank you, Chuck. Hello all, and welcome to today's COVID-19 Community Press Conference. When we last came together in the spring, we announced that we were having these meetings due to the decrease in stabilization in our community and hospital related to COVID-19. So the virus hasn't left Bloomington. However, it is more manageable and has become more manageable over the past few months compared to what we experienced in 2020 and 2021. Everyone involved with this conference loves our community, and we want our neighbors and community members to be happy and healthy. With schools getting back in session, students coming back to IU, we thought it was a good time to re-engage and share what we're seeing in our area. We've become a bit complacent, and all of us are a little tired of worrying about the virus. And as we have seen with the recent variants, most of us are able to weather through it with a few days of really bad flu symptoms, and then we start improving rapidly. However, there are still those in our community, our friends and our neighbors, that are at risk for severe disease, and those friends and neighbors are requiring hospitalization. As you can see here on the screen, we are usually currently in another surge, similar to those we experienced in the summer of 2020 and 2021. However, this surge is a little bit stronger than those surges in its effects on hospitalizations, just like those other increases in prevalence of the virus in our communities and the resulting hospitalizations. This is still having a negative impact on our hospitals, teams, and other patients. Across the state of Indiana, hospitals are again struggling to find beds for inpatients. We are not exempt from this. We currently have 30 patients with the primary diagnosis of COVID in 30 of our inpatient beds. This means that there are 30 less beds that we would normally have for patients that require hospitalization due to the other conditions and surgical services. Over the last 90 days, we have seen a continued increase in our inpatients, and with the workforce shortages across the state and nation, along with the highly complex care that our patients are requiring, it's difficult to provide care for all those who need it. So we need your help. As you can see on this graphic that we distributed frequently during the height of the pandemic, that our vaccinated to unvaccinated hospitalizations changed. We have high numbers of vaccinated patients in our hospital as compared to unvaccinated due to the variants we are experiencing currently. We know that vaccinations work, but not 100% of the time. And we know that the mutations or variants of this virus have been occurring since January 31st of 2020. That's been 2.5 years since the public emergency was declared by the US. Therefore, it is as important as for everyone to be vigilant, whether vaccinated or unvaccinated, regarding your personal health and protecting the health of others. This is a new stage of COVID-19, but we've known that certain steps help protect ourselves and others from the disease, and we need to get back into our pandemic habits. First, get vaccinated and boosted. Vaccines are one of our best ways to fight COVID-19, and we look forward to the new vaccines targeted for variants which are expected to come out later this year. I also encourage individuals to wear masks whenever they are out in public or around people they don't live with, which includes an indoor setting. It's especially important to wear a mask if you're feeling sick and clean your hands regularly. So if you're feeling ill, it's important that you isolate, not pass this virus on to others who could result in hospitalizations. While most of us do not require hospitalization, it is a significant interruption to our lives. In addition, you're passing the virus to others that can cause someone to be hospitalized and have severe disease. As always, I'm happy to answer questions on the conclusion of our remarks. Thank you, Chuck.
Okay, let's next go to the city of Bloomington and the Public Engagement Director, Mary Catherine Carmichael.
Hi, Chuck. You surprised me. I didn't know I was going to be next. Good to see everybody. Although I wish we could stop talking about this once and for all. Wouldn't that be lovely? I bring greetings from Mayor John Hamilton, who couldn't be with us today, but I'm happy to be with you. So news from the city, I wouldn't say there's a lot of it. Our motto and the way things have been going for us is kind of steady as she goes. We aren't seeing a great deal of fluctuation in numbers of employee cases. I think Andrew has a graph he can share. Thanks, Andrew. I appreciate that. So you should be able to see that now. We are continuing to track our employee numbers. Obviously, that graph for August is just the small amount of data that we have so far for this month, but not a great deal of fluctuation, although overall going up. So that is a source of concern and certainly something we're keeping an eye on. We're continuing to do our wastewater testing, and thanks again, Andrew. Again, that is staying fairly consistent across time, although again, we do anticipate as part of the community fills up again with our returning students and other folks, we imagine that the bleacher pool numbers will probably start climbing just because there are going to be more people that will be participating in that, whether they know it or not. All of that information is, thanks. I see Brian got that. Thank you. All of that information is available on our dashboard, of course, online always. We are continuing at City Hall to keep our customer service functions limited to the atrium. That way we can come to you and fulfill your customer service needs. And that helps limit interaction with the rest of the employees in the building just a little bit. And so we're doing what we can to keep everyone as safe as we can. Also, still encouraging all of our employees and really everybody in the city to follow Brian's excellent advice, get those vaccinations, get those boosters. And if you happen to be an employee of the city of Bloomington, you'll get rewarded for that. So we encourage other employers, if they can, to consider those kinds of incentives too, whatever it takes to keep ourselves and each other safe. We want to do that. So as we have been doing for the last couple of years, we're going to continue to follow the science and the good advice that we get from our experts at IU Health. And we thank you all for all you're doing for the community. Oh, and I want to say I think this is our first call without Penny Caudle. So gone but not forgotten. And we just appreciate all the great work that Penny did while she was in our ranks. So thank you.
Okay, and speaking of the Monroe County Health Department, next we welcome Monroe County Health Department Administrator Lori Kelley.
Thank you, Chuck. I did want to share some slides today myself, so just a moment here. Okay. Next slide. Great. So just to start off, I thought it would be important to show a comparison here. On the left was near the end of June. So as we can see on the right, we see many changes in red with an increase of many counties throughout the state. Next slide. Preventing COVID-19 infections and transmission starts by assessing our risk. Areas with low COVID burdens can consider using less protective strategies than those with higher levels of serious disease. As you can see on the screen, as you move up a level, you begin adding measures to reduce risk. So there are many ways in which we can help prevent the spread of COVID-19. The number one most important way is to stay up to date with our vaccines. In addition, if you are eligible, please get those boosters. Next slide. It is also critical that if you have symptoms or you have been exposed, to get tested. If you do an at-home test, please reach out to your home, to your provider. The CDC recommends contacting them as they may advise of PCR testing and can give the most appropriate level of care. Next slide. The CDC guidelines for isolation and quarantine should always be followed. This includes if you or a family member is at risk for serious illness, talk to your provider about other preventative steps, which could include increased masking, limiting exposure, and possible options for pre and post-exposure medications. COVID-19 vaccines are available for all ages. You can call 812-353-3244. At-home tests are available at the health department and the public health clinic. Again, you can call 812-349-2543. This slide is going over the recent updates from the state on K through 12 schools. The CDC is working on updating its school guidelines, and they're expected to be released in the upcoming days. The Indiana Department of Health school updates include no quarantine or contact tracing in K through 12 schools is currently being recommended. There are no recommendations for face coverings in schools or most communities. And schools can decide how to implement masks or other mitigation strategies based on local case counts or community levels. The Indiana Department of Health has a new general wellness screening tool. This is for parents and caregivers. You can log on to the site and go through these checkboxes. If we look through the different checkboxes that are listed, some of these symptoms can include cough or shortness of breath, headache, fever of 100.4 degrees, or chills. If any box is checked, then the recommendation is the child should remain at home. Okay, and that concludes my update. Thank you so much, Chuck.
Okay, let's next check in with the Monroe County Commissioners and Julie Thomas.
All right, thanks, Chuck, and thanks everyone for being here. It's good to be back, but it's sad that we're back. Just a couple of quick updates from us. Just a reminder that the food banks and local pantries are seeing an increased demand for food in our community. And the Hoosier Hills Food Bank is having a Fresh Food Friday. The next one is August 26th from 10 until 2, and that's at 2333 West Industrial Park Drive. Their number is 334-8374 if you have questions. Commissioners will be there helping to distribute. Pantry 279 has also been very busy doing good work. If you need information about acquiring food from Pantry 279, go to their website, pantry279.org. We're continuing to host blood drives with the Red Cross. The next two are Tuesday, September 6th from 1 to 6, and Friday, September 9th from 10 a.m. to 3. These are hosted at Ivy Tech. Thanks, Ivy Tech. Go to redcross.org if you want to make an appointment. We appreciate everyone who's been donating regularly all year long. We still have township assistance money available for every Monroe County resident. Anyone who's been suffering financial setbacks because of COVID, contact your township trustee. Every resident in the county has a township trustee, whether they live in the city or out in the rural areas. And just a reminder that we don't know what lies ahead. We want to avoid a huge increase of COVID in our community. We encourage people to continue to wear masks and to respect those who do. And thank you, everyone, and looking forward to hearing some questions.
Okay, K-12 schools opened this week. We will have Indiana University Bloomington classes back in session on the 22nd, and move-in starts in just over a week and a half. With that in mind, we go to IU Health Officer Aaron Carroll.
Yeah, it's thank you for everyone being here. I wish we weren't doing these anymore, and I'd hope that we wouldn't have to keep talking about this, but unfortunately the world doesn't seem to want to let this go. So as everybody else has noticed, we're all watching the numbers, and whether we call this a surge or a wave, COVID is very prevalent in the community right now, and we're all convinced that the numbers we're seeing likely belie or aren't even telling the whole story, as many people are still testing at home and not reporting those. The good news is, however, vaccinations do work, and the vast majority of our constituents have been vaccinated. Many have been boosted, and we will continue to promote and incentivize those. Our plan and our status looks very much like it did at the end of last spring. We still do contact tracing, although most of it at this point has been automated. Most people at this point know what to do if they are infected or exposed. It's not like the beginning of school 2 years ago when people were very, very, very freaked out and panicked when they heard about COVID. Unfortunately, everyone sort of seems to take it in stride at this point. Our labs are reopening on Monday on Bloomington's campus, at which point we'll have drop-off testing for our students, faculty, and staff, as we did at the end of last spring. In addition, we provide antigen tests to those that want it through vending machines, and for those that need a test. And of course, as everybody else has said, there are many, many, many other ways to get COVID, especially antigen testing these days, both in the community and in retail stores. We continue to be concerned, and we will continue to watch. Certainly, congregate living is our biggest concern, as it has always been. We will continue to encourage everyone to be as safe as possible and to take this as seriously as they can. But we feel as prepared as we have in the past, and we'll have to continue to push forward and hope that this wave passes and further subsequent ones are not as bad.
Okay, thanks, Aaron. So we have some questions in the chat. And again, for our media members, if you have a question, you can put it in the chat and we'll ask that of the panelists. First one from Dave Askins for Brian Shockney about the graphic that shows 11 unvaccinated and 20 vaccinated in the hospital. Just wanted to confirm the accuracy of that. How does that fit into a message that encourages people to get vaccinated?
Yeah, so we want to be transparent. We've been transparent throughout this whole process, where the beginning of the pandemic, we saw the majority of unvaccinated. As this variant, in my comments, I said the variant has continued to change. We're in a variant that the vaccines are not directly targeted for. However, the vaccination does help you in your immunity, does build up some immunity to that. But however, these individuals who are hospitalized are those, just as we saw about midway through the 2.5 years we've been through, where they had many comorbidities, they had chronic conditions that caused them to be hospitalized. So yes, we are looking forward to a tweaked vaccine in the fall that will help us. But the vaccine is still important, number one, to build up our immunity. But this is why we're having this conference. One of the reasons why we're having this press conference today, because even if you're vaccinated, the spread of this virus is increasing across our communities, and we need to protect ourselves. It's not just the hospitalizations, it's also the disruptions to people's lives and their work life and the business, being able to operate businesses and those kind of things that are important here as well. So thank you for the question. And yes, those numbers are correct. And again, why we need to be very, very careful during this period of time of spreading this virus. And I would, defer to Dr. Carroll regarding any other vaccination communication.
This next question also from Dave Askins, Mary Catherine, I'll let you respond to the concern from the city about this as well, but I'm going to start with Aaron actually, because you alluded to a bit of this in your remarks a moment ago. City of Bloomington employee numbers in the last 2 months are relatively higher now compared to the official state health department numbers, but employee numbers include all tests, including home tests that don't get reported. So don't those employee numbers lend some support to the idea that the prevalence of the virus is much higher than the case numbers alone would suggest? And to what extent should we even care that case numbers are stable if we are undercounting? Oh, you're muted, Aaron. Gotta get back in practice.
Again, we haven't been doing this for a while. I got to get back in the swing. So I would respond in two ways. One is that at any level of measurement on any day is clearly undercounted because, as you note, absolutely there are people who are testing at home and not reporting, and the systems are not what they used to be. And so we expect that there are more cases every day than we're likely seeing in any case data. But on the aggregate, sort of following that over time, we probably expect that the same proportion of people that test are likely to report on any given day. And so if things remain stable over time, it's unlikely that, significant portion, the percentage of people who are not reporting is changing on a day-to-day basis. That probably is pretty stable. So the overall numbers, probably not terribly accurate, but we still can trust, I think, the way that the lines go, whether they're going up or down. But of course, we have other data, which is not as easy to miss. Those would be hospitalizations and certainly ICU stays or death. Then what's clear is that deaths have remained quite low, even with this last phase. ICU stays have remained quite low, and hospitalizations, while they have gone up a bit, it's important to be able to tease apart those who are hospitalized because they have COVID and those who are hospitalized and have COVID, because of course, when this is prevalent, lots of people are vaccinated. It's possible that people do get COVID, don't become very ill because of the COVID, but have it while they're being hospitalized for other reasons. So all of that is to say that the data are messy and are likely to continue to be messy, but the ones that we have the most surety about, the ones that we are most convinced cannot be missed, have remained relatively low compared to what we were seeing in other surges, which is good news. That shouldn't limit the fact that we still need lots of people to booster, that we should continue to encourage people to do so, and that as we get more and more immunity, things will be better. But if we're talking about, do we really need to take much more drastic measures because the healthcare system is overwhelmed, or because we believe that there's significant danger, we're relatively sure that that's not going on right now.
Well, I'm loath to follow Dr. Carroll, but I'll just add that we do require and expect that employees will report those home tests. We have had a policy and a procedure in place for that for many, many, many months over the course of this. We ask that they reach out to our risk management and just let us know that they've tested positive. Does everybody do that? Yeah, probably not, but we certainly ask them and continue to ask them to do that. Go ahead, Dr. Carroll.
And for the record, the same applies at Indiana University. Our policies are unchanged, but we'd be foolish to assume. I know people who have been positive and have not reported it. It has become clear that as time has gone on, people are just not feeling as concerned in reporting it, although that is absolutely, we wish they did.
Exactly.
We're requiring them to. It would be great to have accurate data. It's unfortunately just not happening.
Correct. I agree. Thank you.
Another question from Dave, and Aaron, I'm going to direct this again back at you, but it is directed for anybody. So if somebody else wants to jump in on this, please do. Are there plans to adopt any public health policies, gathering sizes, masking, et cetera, if we hit the CDC level of high community spread? Aaron, I know, and as you do, that will be one of the first things we get asked in an Ask Aaron webinar if we do those again soon.
So it's fascinating to me because people ask me, like, will we be doing any public health responses? But what's odd to me is that it's always focused on masking. We're still doing widespread free testing. We are still doing contact tracing. We still isolate people who are infected. We still do almost all of our response. One of the few things we've actually removed is mandatory masking. And the one of the reasons we did it is because the conditions on the ground have changed. If you looked around what was going on in 2020 and even into parts of 2021, COVID classic, as I like to call it, huge numbers of people were asymptomatic, didn't know they had it, and were out there spreading it. And the vast majority of people didn't really seem to get that infected, but still, especially in our population, we're spreading it like crazy. And so you could not possibly know, even with massive levels of testing, who was likely to have COVID and who was likely not to have COVID. Subsequent variants, especially the most recent ones, Omicron and then all its variants, asymptomatic infection is much less likely, or it just doesn't seem to be as prevalent. Almost everybody who has COVID knows they have COVID. They don't all get terribly ill, but they have some level of symptoms. And so we're begging people not to come to work, not to come to class, not to go out of the house when they're sick. That, if people followed it, would take care of a lot of the spread that's occurring. Unfortunately, everybody doesn't do that. But asking everyone to mask in order to prevent asymptomatic spread, because you might have COVID and be asymptomatic and be spreading it, is significantly less likely than it used to be, especially amongst populations where huge numbers of people are vaccinated, which, is both IU and I would think, much of the Bloomington community, where more and more people seem to be vaccinated than in other parts of the state. So we encourage masking for people that want to do it. We give masks out. We certainly would never let anyone discourage anyone from masking. But I'm begging people, if you're sick, stay home. Don't think, oh, we want people to mask because they might have a cough and we don't want to be around them without a mask if they have a cough. We don't want to be around them at all if they have a cough. They should be at home. And so those are the kinds of things we would probably focus on first, rather than reinstating a mask mandate. Having said that, it's entirely possible that if we got a new variant or something that was, so bad that everything I just said was no longer true, and spread got so bad that we did not feel we could contain it, and we thought that mandatory masking would make a difference, I think it's possible you could see a return to masks. I just think that there are other steps that we would likely take before that, and we are taking many of them already.
And Dave issues a clarification to his previous question. He said he wasn't implying that city employees are not reporting to the city, but that those home tests, even if reported to the city, are not reported to the State Department of Health. So those official state numbers are undercounted.
Oh, yes.
Yeah. So this one from Dave for Mary Catherine Carmichael. Is the reason that City Hall remains mostly restricted to public access related specifically to a concern about the spread of the COVID virus?
That works better when I unmute. Yes.
Okay, there you go. So question from Boris Ladwick at the Herald Times. About 2/3 of people are vaccinated. About 2/3 of people who are hospitalized are vaccinated. Why doesn't this mean that vaccines are useless? I'm going to start with Brian, but I want to go to Aaron on this as well.
I just would reiterate what I said before, that the unvaccinated in this variant, we're seeing people with chronic diseases, comorbidities, the high spread, as Dr. Carroll was just talking about. And so the reason we want to continue to share that and wanted to share that graphic is to let people know that being vaccinated is not a cure. We know that vaccines don't work 100% of the time, but we also know that they work to help build immunity and to get through an infection better than if you were not vaccinated. And I'll let Dr. Carroll respond.
I think this gets down to sort of what I was talking about earlier with the difference between being hospitalized because of COVID and hospitalized with COVID. When I talk to my infectious disease colleagues in the hospital right now, if you ask them a year ago, or even when Omicron was raging, they were running around caring for patients because they had COVID. Now, even though numbers of people are hospitalized with COVID, they're not being called to see these patients because they're there, as others have said, because they're hospitalized for other diseases and they also have COVID. because lots of people have COVID, and it's just not causing as much morbidity and mortality right now, especially in vaccinated people. But someday in an ideal world, 100% of people who get COVID will be vaccinated because everyone will be vaccinated. We shouldn't let that convince us that vaccines don't work. It turns COVID from something that caused millions of deaths and hospitals to be overwhelmed and us to run out of ventilators into something where people get it, but the vast majority of people do just fine and go about their lives. That's a major victory, even if cases still remain higher than we'd like.
Okay. We have run through our questions. I'm going to give it a moment more if someone has another question they want to work in. I will just tell you that it's entirely likely that we may have another one of these coming up in a couple of weeks, possibly. We will obviously send out an advisory if we do that as well. I'd be happy to take your questions again there also. But I'm not seeing any other questions coming in. So with that, we will go ahead and call it a day and tell everybody thank you for your time. Panelists, thank you for your answers. Have a good afternoon.
Thank you.
Thanks, Chuck. Thanks,